Symptoms of a heart attack. Including what to do if someone is having symptoms, also main ways to prevent. What is a heart attack? A heart attack happens when something blocks the blood flow to your heart so it can't get the oxygen it needs. It's a medical emergency. Call 911 right away at the first sign of any symptoms. Don't wait to see if the symptoms pass. Heart attacks are also called myocardial infarctions, MIS. Myo means muscle, cardial refers to the heart, and infarction means death of tissue because of lack of blood supply. This tissue death can cause lasting damage to your heart muscle. Heart attack symptoms. Symptoms of a heart attack vary. Some people have mild symptoms. Others have severe symptoms. Some people have no symptoms. Common heart attack symptoms include chest pain that may feel like pressure, tightness, pain, squeezing or aching. Pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth or sometimes the upper belly. Cold sweat. Fatigue. Heartburn or indigestion. Lightheadedness or sudden dizziness. Nausea. Shortness of breath. Women may have atypical symptoms such as brief or sharp pain felt in the neck, arm or back. Sometimes, the first symptom sign of a heart attack is sudden cardiac arrest. Some heart attacks strike suddenly. But many people have warning signs and symptoms hours, days or weeks in advance. Chest pain or pressure, angina, that keeps happening and doesn't go away with rest may be an early warning sign. Angina is caused by a temporary decrease in blood flow to the heart. Heart attack causes. Your heart muscle needs a constant supply of oxygen-rich blood. Your coronary arteries give your heart this critical blood supply. If you have coronary artery disease, those arteries become narrow, and blood can't flow as well as it should. When your blood supply is blocked, you have a heart attack. Fat, calcium, proteins, and inflammatory cells build up in your arteries to form plaques. These plaque deposits are hard on the outside and soft and mushy on the inside. When the plaque is hard, the outer shell cracks. This is called a rupture. Platelets, disc-shaped things in your blood that help it clot, come to the area, and blood clots form around the plaque. If a blood clot blocks your artery, your heart muscle becomes starved for oxygen. The muscle cells soon die, causing permanent damage. Tips for heart attack prevention. The goal after your heart attack is to keep your heart healthy and lower your risk of having another heart attack. Take your medications as directed, make healthy lifestyle changes, see your doctor for regular heart checkups, and consider a cardiac rehabilitation program. Why do I need to take medications after a heart attack? You might take certain drugs after a heart attack to prevent blood clots, help your heart work better, prevent plaques by lowering cholesterol. You might take medications that treat an uneven heartbeat, lower your blood pressure, control chest pain, and treat heart failure. Know the names of your medications, what they're used for, and when you need to take them. Go over your medications with your doctor or nurse. Keep a list of all your medications, and take it to each of your doctor visits. If you have questions about them, ask your doctor or pharmacist. It sounds obvious, but don't skip your medications. Many people don't take their medications the way their doctor told them to. Figure out what keeps you from taking your medicine. It could be side effects, cost, or forgetfulness, and ask your doctor for help. What lifestyle changes are needed after a heart attack? To keep heart disease from getting worse and to head off another heart attack, follow your doctor's advice. You might need to change your lifestyle. Here are some changes you can make that can cut your risk and put you on the path to a healthier life. Stop smoking. Smoking dramatically raises your risk of both heart attacks and strokes. Talk to your doctor about how to quit. You'll also be doing your friends and family a favor, since secondhand smoke can also lead to heart disease. You also can call the hotline 800-QUIT-NOW, 800-784-8669, and visit the smokefree.gov website. Keep a healthy body weight. If you're overweight or obese, you don't have to get thin to reduce your risk for a heart attack or stroke, but your doctor may recommend some weight loss. If you lose 5% to 10% of your weight, you'll improve your cholesterol numbers and lower your blood pressure and blood sugar levels. Follow an exercise plan. Moderate physical activity lowers your chances of a heart attack. It also can reduce your blood pressure and LDL or bad cholesterol, raise your HDL or good cholesterol, and help you stay at a healthy weight. Aim for 30 minutes of exercise that gets your heart pumping at least 5 days a week. Brisk walking or swimming are some good choices. On the other 2 days, do strength training, like lifting weights. If you've got a tight schedule, break your exercise routine into small chunks. Eat a heart-healthy diet. Fill your plate with different kinds of fruits, veggies, beans, and lean meats, such as poultry without the skin. Also up your intake of whole grains, like oatmeal, quinoa, and brown rice, and of fish, especially those with omega-3 fatty acids, such as salmon, trout, and herring. Avocados, olive oil, and flax seeds also have omega-3s, as do some nuts and seeds. Fat-free or low-fat dairy products such as milk, yogurt, and cheese also are better choices for your heart health than higher-fat versions. Cut back on unhealthy foods. Stay away from processed or prepared foods that often are high in salt and added sugar. They're also filled with preservatives. Avoid fatty beef, butter, fried foods, and palm oil. All are high in saturated fats. Skip sugary drinks like sodas and fruit punch, which can lead to weight gain. So can packaged baked goods such as cookies, cakes, and pies. They are high in trans fats and can raise your cholesterol levels. Limit alcohol. If you don't drink already, don't start. If you do drink, limit how much you drink. The recommendation is no more than 1 drink a day if you are a woman and no more than 2 a day if you are a man. Drinking raises your heart rate and blood pressure. It also raises the level of fat in your blood and can cause weight gain. Get regular checks of your cholesterol, blood pressure, and blood sugar, glucose, levels. If you have diabetes, make sure it's controlled. Keeping a check on these numbers can help you be more aware of the changes you need to make to keep these levels within normal limits. Control stress. You may feel anxious or frustrated at times. Open up to your family and friends about what's going on. Support groups can help you learn how others adjusted to life after a heart attack or stroke. You may want to talk to a mental health professional or ask your doctor about a stress management program. You can also reduce stress with plenty of physical activity and mind-body practices like meditation. Pay attention to your symptoms. Don't just hope they'll go away. See your doctor if you feel anything unusual, like shortness of breath, changes in your heart rhythm, or extreme tiredness. Also, watch for pain in your jaw or back, nausea or vomiting, sweating, or flu-like symptoms. If you find this video useful, don't forget to like and subscribe to our channel.